applicant. And I would like to thank the team in Nanavati, which is actually my own team, plus my team at Global Hospital. The work, usually they look after liver, but I get a chance to speak. And we have a very good liver team at Global Hospital, because of which we've got this experience that I'm going to share with you today. And my staff, MRI staff at Global, is also very supportive and has helped me collect this data. So we'll go through, first is concepts. What is MR Elasto is a new technique. So maybe I'll introduce you a little bit to the idea about how it's done, and then we'll talk a little bit about liver fibrosis because of MR Elasto, how its management is changing, and a few other applications that MR Elasto can do. So we all know, we all have done this palpation of liver, of body tissues, which allows us to understand whether there is any hardening or is the liver, etc., or other organs soft. And this is the same thing that we use for the principle of MR Elasto. So you can also use elasto in other parts of the body, including brain. We'll talk about that a little later. But it's just like as if you're touching the tissue and you're trying to find out whether it's hard or soft, and that will give you an idea whether it's normal as expected when it's soft, or is it diseased when expected when it's hard. So normal tissues soft, diseased tissues hard. And till now we've had ultrasound, a non-invasive method which allows us to evaluate elasticity of the soft tissues, and that is very well known as FibroScan. But in that, there are some limitations. We'll see that a little later. And now MR is establishing its role in hepatology, mainly in hepatology, because the others are still, the clinical data has to be gathered. And this is because the transplant techniques are being pushed largely, plus medications for treating liver disease are also coming through. So whenever there is support from the clinicians and the surgeons, an MR technique develops well. So what is the idea? That normal liver is soft and viscous, and it does not allow waves to propagate through it, whereas hardness, which comes because of fibrosis or tumor, it allows rapid progression of waves. So what are we doing? We are actually disturbing the